TargomiRs are targeted microRNA constructs, and they are packaged in a mini cell, in a nanocell, and those nanocells are covered with an EGFR antibody, and so they are targeted to the tumor, which is expressing EGFR, and arriving there, they are delivering their payload, and these are the microRNA constructs. MesomiR-1 is the phase 1 study where we are defining the optimal dose, toxicity optimal dose of the TargomiRs. And actually this abstract is pointing to the fact that already in the first 6 patients that we included in that phase 1 study, there was activity of this medication in terms of response and disease stabilization. The duration of the response, the duration of the response in that patient that responded is remarkable. He is now for more than 30 weeks on therapy, and it is an almost complete response. It is a near complete response. We are reporting on the first 6 patients. It is a classical 3 to 6 dose escalation cohort study. We did that because the earlier experience with the nanocells, and actually that is a technology that was invented by Engenic, that is a biotech company in Sydney. Their early experience showed that there was dose-limiting toxicity, so we started in this study also with a classical approach of 3 to 6 patients in every cohort, and while exploring that first dose that we had calculated on the basis of animal experiments, we saw suddenly a response, a remarkable response, and also disease stabilization in 4 of the 6 patients. Tolerability is quite good. Patients are tolerating the medication well. There is 80 to 90 minutes after the infusion of the TargomiRs, there is a period of shivering in most of the patients, sometimes rigor. That is of 20-30 minutes duration, and then patients generally feel better. We did repeated quality of life measurements in them, and the majority of patients, actually 5 out of 6 patients, they reported to feel better, to be a bit more active, and to have less complaints, general and local. The next step is we are continuing with this dose escalation study, and obviously the patients that are on therapy in this first cohort, they are 8 weeks on therapy, and then they were re-evaluated. They continue to be on therapy, so we are very curious what we will see in the next coming month. There is also a potential for other tumor types. The study is also open for non-small cell lung cancer. A similar defect of microRNA 15/16 family has been noticed in non-small cell lung cancer. And so far we have been unable to include non-small cell lung cancer patients because the amount of patients with mesothelioma presenting through their clinicians in Australia was amazing. Now, microRNA, this family, the microRNA 15/16 family, is more or less a You may describe it as a housekeeper and also as a tumor suppressor. If the levels are low, then a normal housekeeping is disturbed, and apoptosis is disturbed, and proliferation is increased. And when you add this microRNA in cell culture and also in experimental animals, and then the microRNA should be packaged in the mini cells, then you see a slowing down of tumor growth or complete stop of tumor growth. It is a two-step approach. One is that you target the payload of the nanocells in the direction of the tumor, and then it is expected that the mini cells, that they are escaping the vasculature through the leaky parts of the tumor vasculature and internalized in the tumor cells, and then get rid of their construct payload, and then they're able to restore normal apoptotic mechanisms and induce a slowdown of proliferation. If this works and shows to be efficacious, there are potential significant application, not only mesothelioma, but also non-small cell lung cancer, and we have tested this approach also in other tumor models, and there are several who respond in a similar way. So it is precision medicine, but it is covering quite a broad area. I think a good thing is to realize that this is the result of an intensive cooperation between a research lab and a biotech company, Engenic, from Sydney-based. They had that nanocell technology, which is, by the way, also inducing some sort of an immune mechanism, because all the patients, they are reacting on the nanocells with some feverish symptoms, and if you look into the blood, there is lymphopenia, immediate lymphopenia, neutrophilia. So the innate immune mechanism is affected by the mini cells. And then obviously the microRNA background that was invented in our institute. And together we made this in quite a swift time from the lab to the clinic. And now this study is activated in 3 major academic hospitals in Sydney, in the Northern Cancer Institute, in Chris O'Brien Lifehouse, and in Concord Hospital. So it's a wonderful cooperation.